Transmitiendo nuestra comunidad al mundo.
Good morning, everyone. I'd like to welcome our Facebook Live followers for this session on Friday, a session that we host almost every Friday. It's the end of October, close to Halloween, and we're very honored to have two guests with us. But before I do that, I'm Eladio Pereira, the Chief Medical Officer at Mariposa in Nogales. We are transmitting from our main conference room. We try to provide information that is practical to our patients and other followers. And for the last few weeks, essential has been COVID-19, and we'll continue to do that. But today, we're going to deviate from the norm in the last few weeks, and we're going to speak about hepatitis C treatment. As you know, hepatitis C is almost always a chronic infection, and I have invited our clinical pharmacists to be with me today. I'm going to let them introduce themselves and what role they play in our clinic. Following that, I'll talk a little bit about the virus, and then we'll engage in a conversation about what we do, what we have to offer. We've been very fortunate that we have begun treating Hep C at the primary care level. I'm very proud of that, thanks to our clinical pharmacists. So I'm going to let he and Gina introduce themselves here. Welcome.
Thank you. Hi, my name is Hia, one of the clinical pharmacists here at Mariposa Community Health Center, and thank you for inviting us to be here today. We're very excited.
Welcome here.
Thank you for having us. My name is Gina Suzuki. I'm also a clinical pharmacist here at Mariposa Community Health Center.
Great. Well, welcome to both
Thank
of you.
you.
We appreciate the work you do. For those of you who don't know, our pharmacy provides outstanding services. We're very fortunate to have really great pharmacists to help us at the clinical level. We are depending on our pharmacists more and more for a number of reasons. One has to do with clinical indications, dosing requirements, monitoring, and all of that. The amount of knowledge created has become so vast that clinical pharmacists are an essential part of the team. And I think our clinical pharmacists are doing that. So thank you very much.
Thank you.
Since COVID-19, our pharmacies has changed the entire operation, not just dispensing meds, but we're now curbside service, but also delivering medications at home. And as of a few days ago, we had delivered over 9,000 prescriptions to our patients so that they don't have to come and they don't have to leave their home, therefore minimize exposure. So our pharmacy is just outstanding. We are ready to talk about Hep C, and I just make a few comments about Hep C. Hepatitis C is one of those hepatitis viruses, and there are quite a few, A, B, C, D, E and G. But the names Hep A is mostly foodborne, and it's mostly like an infection. It doesn't cause a chronic illness for the most part. There's a syndrome of relapsing with Hep A. Hep B, it transmitted differently by body fluid exposure. It causes chronic infection about 5% of the time. There's treatment for Hep B as well. We have good vaccines against Hep B, and I would recommend that everyone who's watching us speaks with their provider about vaccination for both Hep A and Hep B. Hep C is a chronic infection for the most part. There's no vaccine, but there's good treatment, and that's the reason we're here today. Hep D depends on B. Hep D is a virus that will only infect anyone who has Hep B, hepatitis B surface antigen. Hep E, we don't see much in the U.S., mostly seen in Southeast Asia. It's transmitted very similarly to Hep A, but the issue about Hep E, it tends to attack pregnant women with a fatality rate of 20%. And Hep G, we don't know a whole lot about Hep G, still learning. But Hep C has now good treatment. It's a bloodborne infection, affects about over 2 million people in the U.S. But the good thing is that we're now trying to manage that at the primary care level. Not every patient can be managed at the primary care level, but quite a few. And he and Gina will talk about that. Treatment is highly effective. The important aspect of a Hep C is that now screening is recommended. And it's recommended now for everyone under age 18. You don't have to have a reason. We just test it. So 18 through 79 years of age is a recommendation. And as such, we're detecting more and more. Prior to that, the recommendation was testing the baby boomers, 1945 through 1965. The reason for that was that about 3/4 of all patients with Hep C were born in those years, 1945 to 1965. But that changed a few months ago, and we're now recommending screening for Hep C after age 18. The same thing for HIV. We're now recommending HIV screening for anyone over age 13, according to CDC. And for Hep C, the critical piece is that we're now talking about cures, which years ago we couldn't even think that would be possible, and we talk about that. And what we know is that with treatment, we reduce the rate of complications, the progression to chronic liver disease, and we reduce mortality. Essentially, that's the reason we're here. So I'm going to ask our guests couple of things. Number one, tell us about cure. What things we do once we diagnose the infection. We do an antibody test followed by the RNA. So what happens after that? We follow a number of things to determine treatment. We talk about cure, which is sustained viral load. So once we make a diagnosis, what happens after that?
So a lot of things happen, and that's why we're here to help our providers and our patients. So first thing we'll do is sit with our patient, go through the process where we will have to get a prescription from your doctor, and we make sure your insurance is providing the medication, and we make sure you are getting the medicine from the pharmacy, whichever you prefer, and depending on patient's insurance plan. And we start the medication, but before starting the medication, we need to double check a lot of things, including your blood work, also your baseline symptoms that might be from hepatitis C, or it might be just your baseline from other chronic conditions. And we need to double check what current conditions and medications you're currently taking, so we prep everything before you're taking the medication. So usually the treatment will take about 8 weeks to 12 weeks, depending on your situation. And it's very simple regimen. You take 3 tablets a day, or depending on the brand name of the medication treatment course, we do take 12 weeks of 1 tablet a day. That's the most common one we see here at primary care setting. And then after you start the medication, we would follow up over the phone. So that way you don't have to come to the clinic. And we talk about your experience the first 2 weeks of your treatment, how you're doing, what's bothering you, making sure we are leading you into the right direction of being cured from hepatitis C. And at week 4, at 1 month follow-up, we'll do another blood work to make sure your medication is working right way. And that is, of course, delivered to your primary care doctor. If necessary, they will reach out to you, sit down with you if they have any questions. And we will be following up with you on a monthly basis until you're done with the treatment. The most important thing in this treatment course is you actually getting the cure diagnosis, which can be decided depending on your virus amount in your system. So we'll check that 3 months after you're done with your treatment. So that we're looking at about 2 to 3 months of treatment. And after that, we wait 3 months and we check your blood work again.
So what we're looking for is an undetectable virus,
Yes.
right? Yeah. Excellent. Gina, can you talk about the importance of, the consultation with the clinical pharmacist is really important, I think, for the reasons you mentioned. But a lot of our patients take other drugs. Can you speak about the importance of drug interactions in general terms? Because that's what we do. We want to make sure that the drugs that we prescribe don't affect the ones you already take and vice versa. Can you expand on the importance of drug interactions?
So as Pia mentioned, we are in direct contact with these patients regularly. Before the medication actually gets delivered to the patient, we are going to check for drug interactions, and we'll be in consultation with the primary care provider if there's any issues that would come about with the regimen. And if there's a drug interaction, we will let the provider know about that.
And there may be, not always, but sometimes there's a reduction in dosage, or depending on how important the drug is, the medication may need to be discontinued for some time.
Exactly.
We're very fortunate that these regimens are not only safe or efficacious, right? Can you talk a little bit about the safety and the efficacy of these drugs?
For the most part, we've had, for all of our patients so far, every patient that we've had 100% success. The patients have had no problems for the most part on these. They're very safe to take. They're very efficacious. If we need to make any medication changes with their current regimen, just a small change for a few weeks, for 8 to 12 weeks while they're on the medication, then we can put them back on their medication.
Okay.
But they are safe, they are efficacious.
Okay. What happens, so we've done the testing after treatment, and we get that week 12, and we get that undetectable. What happens after that? Can you talk about the steps we follow to monitor the patient after that? And I want to come back to the possibility of reinfection, but what happens after that? How often do we need to monitor blood tests, and what are the precautions we take after the infection is cured?
So after the infection is cured, we celebrate first because they're done. And we want to make sure that our patients are not coming back with the same condition again, but it happens. It happens depending on their occupation, depending on their lifestyles, because it is bloodborne.
Yeah.
It's not very common, but it can happen. So the most common thing our provider here at the primary care practice would take is check your liver function on a regular basis, just like how you do an annual wellness visit.
Right.
And if they notice any unusual level in your liver enzyme, what we call, and they would actually check again to make sure it's not reinfected.
Right. And sometimes the clues to reinfection is an elevated liver test for sure, you can get a fever, you can get a jaundice,
Mhm.
and at that time we'll have to do another RNA test to see if it becomes detectable again, right?
Yes.
That's the
Mhm.
key. So Gina, what other thing should happen after that? You have some recommendations of avoiding certain medications after that, so we make sure they don't drink alcohol. What other medications we rather have the patient not take?
Well, we don't want to have our patients take over-the-counter pain relievers
Okay.
unless their provider is aware of it.
Yeah.
Just make sure that your primary care provider is aware of all the medications that you're taking while you're
Right.
being treated for
Because some
hepatitis
of
C.
them can affect the liver,
Mhm.
Sure.
and we don't want any drug interaction. There's always a question about Tylenol.
Tylenol, anti-inflammatories. Just make sure that your providers are
Right.
aware of all the medications that you're taking.
I think it's best to avoid. However, there are some recommendations.
Mhm.
For example, it's okay to take Tylenol if it's kept under certain amount. Usually 2 grams is what's recommended. But always check with the provider. I think we want to minimize the use of those drugs to minimize any potential issues. Reinfection can occur. The antibody is not protective. So we always advise the patient just to be careful about any potential exposure. That's the key about monitoring is reinforced lifestyle, right? Yeah.
Mhm. It's not very common, but most common transmission way
Yeah.
that we see is sharing needles,
Yes.
born from the mother who had a hepatitis C infection, not aware, so they can definitely get tested again. And another one we see is sharing a razor from household
Yes.
or toothbrush. So very simple, and we do see very commonly, but that might be something that you also want to be aware of and careful. Yeah.
That's great. That's great. The regimens are easy to take.
Mhm.
There could be 2-3 tablets a day, depending on the regimen. They all seem very good in terms of overall response. There are some details that we manage in terms of the genotype or the strain, but that's us managing that. There will be times in which we need to refer patient to a specialist. Perhaps if the treatment may not be as effective as we thought, or there may be the presence of advanced liver disease. For example, if someone has cirrhosis of the liver, that could affect our treatment plan. Patients who have fibrosis or cirrhosis may need other things too. For example, if you have cirrhosis, you may need to have an endoscopy done to check for esophageal varices, for example, and treatment may need to be started. So there may be other, in addition, I forgot, ultrasound of the liver every 6 months to monitor for the development of carcinoma of the liver. Alpha-fetoprotein is no longer recommended for monitoring, just the ultrasound every 6 months. So the idea is that our monitoring is key for the development of advanced liver disease, and we may need to refer out to a specialist that can help us with that. But we can still help with the regimen at the local level to monitor, correct?
To begin with, yes.
Absolutely, absolutely. Anything else you like to say about the kind of work you do with Hep C? Is there anything, other aspect that you want to emphasize? Adherence is important.
Adherence is very important.
Can you comment on that?
We just want to make sure, a big part of our phone call is to make sure that the patient is tolerating the medication, and that we get through the 8-week course or the 12-week course, whatever it is. If there's any problems at all, we want to know about it, so that we can report to the provider.
Great. Any other thoughts on that? Any others? Vaccinations are important?
Definitely. Before we start the treatment, we make sure you are getting hepatitis A vaccine and B.
Right.
you probably remember getting some sort of hepatitis vaccine that doesn't include a C.
Right.
So yeah, don't get confused between different type of hepatitis.
Right. And I think for Hep C, strongly advised that we vaccinate patients for Hep A and Hep B. That's
Yes.
part of our treatment.
They all attack your liver. So
Absolutely. And we do recommend regular healthcare maintenance for these patients. We must not forget, if you're over 50 and very soon over 45, colorectal cancer screening. For those who smoke, depending on the age, we need to screen for abdominal aortic aneurysms. We need to screen for lung cancer. So while Hep C is the main topic today, we at Mariposa want to look at the entire patient so that all indicated vaccines are given, all screening tests are provided to have a better life and do that. So I want to make sure we do that. We always advise quitting smoking, but smoking does bring some risk and some ideas about where to go next, particularly when we screen for abdominal aortic aneurysms, or now recommended to screen for lung cancer, just like colon. And in women, of course, we screen for breast cancer and cervical cancer. We must not forget that. Great, thank you for those comments. So I'm going to spend the last 5 minutes or so on COVID, because we always have to talk about COVID. We've seen an increased number of cases in the country. You know, the last time we had a surge in the country, Santa Cruz County lagged behind, but were hit later. And my concern that will happen again unless we take precautions. I've said before that the number of cases in a county dropped after the mayor instituted the mandate for masking on June the 18th. And if you look at our graph, it was after that date that the number of cases dropped significantly. So I want to emphasize the importance of masking, keeping the distance, good hand washing. And at the moment, a lot of the new cases, not just in Arizona, but in Texas and other places, are the result of exposure at home and social gatherings. So we want to minimize that, because you don't know. If you have a social gathering, we don't know where that person has been, and we know that people can have symptoms and still transmit the infection. So social gatherings should be reduced. We still emphasize testing as part of the overall strategy. It's not the entire solution to this, but we want to test individuals who have symptoms of fever, cough, shortness of breath, loss of smell and taste, and a few other symptoms. We also want to know about close contacts. Definition has changed as of a few days ago. Now it's 15 minutes cumulative over 24 hours, not at once, within 6 feet. Those individuals should be identified, sometimes tested, but they should be quarantined too. And I think we're moving more towards quarantine rather than testing, because the testing could be negative, particularly if it's early and after contact. And then at Mariposa, we're targeting certain populations for testing, those at risk, particularly the schools and certain other industries. Education is key. This is a respiratory illness that affects systemically the body, the brain, the heart, the kidneys, etc. So we want to make sure that people take the precaution with masking when we're in public. We work closely with the health department in terms of contact tracing. Contact tracing is a critical component, just like testing, just like prevention. To reduce or mitigate risk, we recommend that if you get a call from the health department, perhaps with a notification that you may have been exposed, that you work with them and be truthful and tell them where you've been in contact with, because the only way to contain this is to mitigate risk and mitigate exposure. So contact tracing is a critical component of all of this. And finally, at Mariposa, we continue to use the PCR test. It's more reliable. We don't use the antibodies not recommended by CDC for acute infection. We use the nasopharyngeal swab and the nostril test with LabCorp. We also use the saliva test with ASU for more larger scale testing, such as the school. So we want to emphasize that. And finally, if you become ill, you stay home and call your provider. At that moment, he or she will decide whether you should be tested, and you should stay home after symptoms resolve, at least 24 hours of no fever. If you test positive, then there will be other recommendations, typically at least 10 days in isolation, and no fever for a day, 24 hours, and improvement in symptoms. The recommendations do not include resolution of symptoms. They only recommend improvement in symptoms, because some of these symptoms can persist, but you're no longer considered infectious. For those who are immunocompromised, the isolation is different. It's 20 days, depending on various factors, because it looks like the immunocompromised infectiousness may last longer. Instead of 9, 10, 11 days, you're looking at 14, 15 days. That's a reason of 20 days. That's what CDC recommends. So today, in summary, we cover hepatitis C treatment. We cover how it's transmitted. We cover the screening recommendations, some of the symptoms, the treatment, the monitoring, and the surveillance, drug interactions, what to avoid. And then we cover some of the salient aspects of COVID-19 testing. I want to thank our guest today, Gina and here, for being here today. Thank you for your contribution today. I want to thank Marco and Edgardo for making this possible. I want to thank Mariposa, all our staff, for doing an outstanding job during COVID-19. This has been a great effort to keep our community safe. I want to thank our followers for trusting us with their care. And I think that's going to be the end of today's session. We will see you next week at about the same time. We have a couple other topics that we'll be including COVID-19. There's some new information that's coming out, but we'll discuss that next week. I think that will be it today. If you have any questions, we'll answer that on our Facebook page. But I think we're going to end at this moment. Thank you, everyone. Have a great weekend. Stay safe. And keep your mask on and no social gatherings. We'll see you then. Thank you very much.
Transmitiendo nuestra comunidad al mundo.